Thank you to the members for all the questions that they've been submitting. And I'm going to discuss one of these questions in a way not specifically to answer the question, because I don't want to supply direct medical advice. But what happens when medication doesn't seem to work for your child's behavior, learning, and ADHD? This is a common problem because often children come to me once they've seen several doctors. They've had problems with teaching at school, learning at school. They've been to several therapists. By the time they get to me, often they've been on several medications and lots of treatment options have failed. So this is not an uncommon situation. And the scenario that we're going to talk about is a child that is in about grade 2 or 3 and has been through several schools, and I don't know the situation, but might have been asked to leave several schools because of behavior problems. And when these problems start out, they've obviously originated and started off much earlier than that. Parents would have been really having difficulty at home with their child, and there would have been behavior problems at home, not only at school, but in all social circumstances. And unfortunately, when behavior issues create a problem at home, they're also going to be often issues at school. And when a school asks a child to leave, that is really serious. I've seen children that have been expelled from 3 preschools by the time they even get to the age of 6 and go into grade R. And these are problems that are serious. They are impulsive. Children have no regulation. They often are quite physical, often boys. They happen to be very, very kind of aggressive, behavior problems. And when they go into a school situation, then they have to kind of sit, listen, do. They've got to integrate. They've got to be able to regulate. They've got to get on with other kids. And this becomes a big problem. And, often what happens in families, particularly when there's been a separation or a divorce, these are situations where a child spends a bit of time with one parent and another. And often the thread of the behavior is not well managed together. So a child doesn't seem to have one voice, one manager. They tend to have different voices, different kind of styles. And this can also create a conflict. So when a child has been on several medications, and the medications that have been mentioned, I guess, probably has been Ritalin stimulants, because they are still the most effective medications. But when they don't work, and then there's something called risperidone, which is called an atypical antipsychotic. I know it sounds quite severe and quite serious, but it's a medication that's used in young children. Unfortunately, in a country like ours, we rely on medication more because we don't have the support services. We don't have the resources, the social services, the psychological services that support teachers at school. And I feel quite desperate because I often find we rely on medication more when we shouldn't be. Because, interventions with lots of psychological services, occupational services, special therapy, play therapists, psychologists, and also the staff at school to be able to have facilitators, teachers that are specifically trained to be able to deal with difficult children that have difficulty settling down at school. And unfortunately, we don't always have those resources, and parents don't always have the resources to pay for those things. So it's a very frustrating problem, but I do understand. And often we rely on medication to overcome, unfortunately. It's a bit of a blunt instrument. It's an indictment, unfortunately, on the situation that we have. And then the other medication that was mentioned, something called Abilify, called aripiprazole. And that is also a new generation of antipsychotic. It is a medication that often works differently when children are on risperidone or Risperdal. They tend to gain weight. their weight is stimulated. So on the one hand, the Ritalin, the stimulant, depresses the appetite, and the atypical antipsychotic like Risperdal increases the appetite. And Abilify doesn't seem to do that as much. But these are very expensive medications. I mean, Abilify, it's like about 80 or 90 Rand a tablet. I know that there are some generics, but it's incredibly expensive treatment. That really shows the extent to which a child is really suffering and in a lot of pain. When we have a child who's tried on lots of medications, we've got to step back and ask ourselves, what is the problem? What is the diagnosis? In my practice, what I do is I take a step back and I say, where is this problem coming from? Often these things are genetic. When I talk to parents, there may be a family history of learning difficulty. If your child's at school and really battling with a learning disability that's not been detected, how can you expect your child to function, communicate? They have a very negative self-esteem. Sometimes children have difficulty sitting, learning. When they find themselves in a situation, just think you and I trying to learn a foreign language and having to sit and kind of learn this language when you don't have the ability to. And of course, there's a constant negative vibe with the child. They're constantly taking incoming fire. They're constantly being reprimanded. So everything's negative, and together with a difficulty with, emotional regulation, impulsivity, learning difficulty. There's often a thread of a family history of bipolar disease, learning difficulty, ADHD, oppositional defiant disorder, conduct disorder. And if these things are not determined and treated and managed early, this can have a huge outcome later on. The end result can be a lot of anxiety, depression, bipolar, conduct disorder, and lots of infringements with the law and imprisonment. So these issues are huge. But I would say, very importantly, that sometimes when medication doesn't work, we've got to start off with really good therapists with behavior programs. Parents are the ones that need to be helped to manage. And often, I know diet is often poo-pooed by a lot of doctors, but I really think there is a role to get to grips with what the diet's about. Sometimes children don't respond well to sugars, and they do have sometimes underlying medical problems. Children with behavior problems, I always do an EEG. And just recently, I had a child who has huge behavior problems. And they have had this intermittently for a while. And we did an EEG, and it shows this child has a subclinical temporal lobe epilepsy, where the brain waves in the emotional centers are not well controlled. These are seizures that people don't really realize. They are subclinical. They don't really kind of come to the visibility of anybody. They kind of what we call subclinical. They don't have typical epileptic symptoms. And there are sometimes some anti-epileptics that make a big difference. Something called sodium valproate or Epilim is used, and it can be used as a mood stabilizer, also to help for the electrical flow. So what I would say is, when parents are desperate, what I often see is that we've got to make a proper diagnosis. Is there an underlying medical problem? Subclinical epilepsy, huge genetic predisposition to bipolar condition. And when a child behaves like this, you often worry about early bipolar. And I would say that that needs to be managed with medication that helps with mood stabilization. In my experience, I've found Epilim to be very effective at the right dose, together with a holistic team approach. This child needs an experienced teacher, an experienced psychologist that understands behaviour interventions. And, a child cannot be helped unless the parents are helped, and both parents need to be on the same hymn page. So I hope this helps. And I would say that this is something that the parents should consider, is go to a doctor who understands these behaviour problems and can manage and unravel everything.